February is Heart Month for all, yet women are less likely to get their hearts screened. One woman is sharing her story after a routine screening revealed a life-threatening condition she didn't even know she had, highlighting the importance of early detection and prevention. At 80 years old, Janet Coleman says she's healthy, active, and feeling just fine. So when her doctor suggested a routine heart screening, it came as a surprise.
Janet was a surprise case. She is an otherwise very healthy and active 80-year-old female whose doctor decided, you turned 80 this year, we should check your heart. She incidentally had a CAT scan of the arteries of her heart, and it showed that she had some plaque buildup.
While that scan showed plaque buildup, doctors found something far more dangerous.
I sent her for an echocardiogram, and she was noted to have a very large aneurysm in the ascending arch, meaning the aorta is the big pipe where all the blood flows from the heart to all the other parts of the body.
What came as a bigger shock was that Janet had no warning signs.
I had no symptoms, no dizziness. No lightheaded, nothing. I was fine, and I couldn't understand why all of a sudden, what's happening?
Within hours of her test, she was told to get to the emergency room as soon as possible.
Then I had, errands to run, and I was going to go on home and get ready to put stuff away and get ready to have a party. And Dr. Daniele called me before I got home, and I thought, oh, this can't be good. She asked me to come by, and so I had one to talk to me. And within the 3 hours from the time I had the test, I was in the ER.
Janet's doctors say the size of her aneurysm was rare, measuring more than 7 centimeters, about double the size normally seen, putting her life at immediate risk. That's when cardiothoracic surgeon Dr. Heidi Reich quickly stepped in.
This is a condition that I think can be easily missed because the overwhelming majority of patients don't have any symptoms. They have no advanced warning signs, and aortic aneurysms can be very dangerous for patients, especially when they're as large as Miss Coleman's was, in that as an aortic aneurysm gets larger, it's kind of like a water balloon that's filled too full. The bigger it is, the thinner walled it is, the more fragile it is, and with blood pressure fluctuations, the wall of the aorta can actually rupture or tear.
In other words, you're at home and this ruptures, you have a 90% chance of dying.
Days later, Janet had surgery. Doctors say teamwork and quick action saved her life.
It was really because of Dr. Daniele's advocacy for her patient that we were able to come together as a team to really rally to make sure that there weren't any avoidable delays in her getting timely care.
Janet's story highlighting an important message for Heart Month: don't skip screenings and don't ignore the risk factors.
Someone, either yourself, your loved one, someone you know has heart disease right now. And screening is the most important thing that you can do. Don't ignore your symptoms. If you're having symptoms, you know your body. If something's not right, seek medical attention so we can vet out what the problem is.
And the textbook descriptions of heart and vascular disease in women doesn't really fit with our lived experiences in our female bodies. So we describe it as best as we can. Having a team that is familiar with recognizing subtle signs is really essential. But if someone feels like something's not right, trust your gut, see your doctor, and that way you can get the best possible care that you need.